50 years old man has arterial blood gas sample taken and following result obtained. He is breathing in room air. PA is 7.2. Partial pressure of oxygen is 7.5. Bicarbonate level 22. Partial pressure of carbon dioxide 8.1 and chloride 10. Which of the following condition or which is the condition listed below is most likely to account for these findings? Here are the answering options: type 1 respiratory failure, metabolic alkalosis, metabolic acidosis with normal anion gap, metabolic acidosis with increased anion gap, and type 2 respiratory failure. So it had no important clue here, only there is PA is 7.2. That means which is the acidotic condition, but we have to find other option here, such as partial pressure of oxygen, it is 7.5, but normal partial pressure of oxygen level is 11 to 14. That means partial pressure of oxygen reduced. That means the oxygen diffusing organ, which is the lungs, there is pathology in the lungs. So in this condition, the acidic condition due to respiratory cause, and this is metabolic respiratory acidosis. First of all, let's see some important parameter which is very important. PA is 7.35 to 7.45. Partial pressure of carbon dioxide 4.5 to 6 kilopascal. Standard bicarbonate level, it is 22 to 28. So these three important parameter very important to remember for solving any type of the ABG report or arterial blood gases report. Another one important, which is the partial pressure of oxygen, which is normally 11 to 14 kilopascal, and anion gap 10 to 16, chloride 98 to 107. As it is proved that it is the respiratory acidosis. So in case of respiratory acidosis equation, this is the equation which is the PAs, when PAs will reduce, but the other two options, that means the partial pressure of carbon dioxide increase, bicarbonate will be normal, and if compensation occur, then bicarbonate also increase. So the changes, first of all, PAs in case of respiratory acidosis, it is reduced, and partial pressure of carbon dioxide, it is related to the lungs, so partial pressure of carbon dioxide also reduce, and bicarbonate initially normal, but if compensation occur, then it will increase. The partial pressure of carbon dioxide, it will increase. Partial pressure of carbon dioxide, it will increase when PA is decrease, because in respiratory case, PAs and other parameter, they goes in the opposite side. So in this equation, first of all, PAs is 7.2. that means it is the respiratory acidosis. Now we have to find out what the other findings. Now see the partial pressure of carbon dioxide, which is the second most important parameter. The normal level of partial pressure of carbon dioxide is 4.5 to 6, but here it is more than 6. That means PA it is less, and partial pressure of carbon dioxide, it is increased. So it is the metabolic acid, it is respiratory acidosis. But here we can see two type of respiratory cause here present. One of them is type 1 respiratory failure, another one is the type 2 respiratory failure, and both causes the respiratory acidosis. Now see the difference of type 1 and type 2 respiratory failure of respiratory acidosis. Here the type 1 respiratory failure, in type 1 respiratory failure, there is partial pressure of oxygen which is low, and partial pressure of carbon dioxide usually normal or low, usually normal. And in case of type 2 respiratory failure, partial pressure of oxygen reduce and partial pressure of carbon dioxide high. So this point is very important, that in case of type 2 there is hypoxia, oxygen level reduced, that means there is the certain hypoxia, and but there is increased partial pressure of carbon dioxide, that means there is hypercapnia. So when there is hypoxia and hypercapnia, in this case it is type 2 respiratory failure. But in case of type 1 respiratory failure, there is only hypoxia, there is no hypercapnia. There may be hypocapnia but no hypercapnia. And in this equation here we can see this is the hypoxia, that means oxygen reduced, and hypercapnia, that means partial pressure of carbon dioxide increase. So it is type 2 respiratory failure. In type 2 respiratory failure there is hypoxia and hypercapnia present, but in case of type 1 respiratory failure, here only hypoxia, there is no hypercapnia. Sometimes hypocapnia may develop.